Hey, good afternoon. It's Michael here at Interstate PR in the home studio office, working on a little bit of lighting issues, trying to see if we can get things a little better because these bags that you see under my eyes actually don't show up in normal light. Um, Today, I'm very privileged to have a longtime friend of mine and client on, Dr. Mike Jones, who is in Katy, Texas. Mike, how you doing?
Good afternoon. How are you, sir?
I'm doing very well, thank you. So the reason that I asked Dr. Mike to come on today is very simple. He has a business that has been operating as an online type business for 20 plus years. Very successful at it. Has a great model, and honestly, is in a situation where he's also an essential business and deals with clients in a number of ways. And Mike, I thought I'd bring you on to see what things that you've done over the years to set this up, how it is to be an essential business, and maybe if you had any tips or tricks for people who are kind of adapting to this and how you've helped people along the way. So let's get started with this. How are things going for you and your wife?
Oh, actually, we're right outside of Houston here, and we're actually doing well. Um, we've stayed home. We watched dozens of episodes of Games of Thrones. We watched every NBA or NCAA basketball final since 1983. We've exercised, we've read, we've done everything. So we're actually we're having a good time. Now, on top of that, we're still running our businesses. My wife is an occupational therapist, so she's still going out to see patients. Um, our facility, we're still seeing some clients in our facility. It depends on their category. But I have to be honest, for the most part, this has been kind of a time out for us to kind of catch up on some things and do some other things, and also to get in contact with old friends and relatives we haven't talked to in a long time via the internet. So it's worked out pretty good.
So for those of you, for those of people who are watching and don't know what you do medical exercise training,
Yes.
and you do it in two facets, right? You not only teach people how to do medical exercise training, and then on some occasions you actually work with clients to do medical exercise training, right?
Sure.
Can you give us the elevator pitch, if you will, on what medical exercise training is, and what made you think of doing it online when you first started doing?
Okay. Oh man, that takes us back quite a long way. I'm actually a physical therapist. I went to undergraduate school and got my physical therapy degree at Howard University. I graduated back in 1985, and for a few years, I was an Army officer. And then after that, I got out of the service. I went back to Washington, D.C. and established my own sports medicine and physical therapy clinic. Back in the early 1990s, we started to see there was a significant loss in reimbursement for physical therapy sessions. Patients we could see for months at a time, the insurance carriers were cutting back on. So we decided to develop a mechanism where we could train fitness professionals in our community to effectively and safely manage some of these individuals with medical conditions after we had gotten them through the acute and subacute stages, so that they could continue on with their exercise. We knew from the research that the exercise was important, so we put together a program called the Medical Exercise Specialist. We started in 1994. We started with 14 people in a course in 1994. And now, as of 2020, we're on 6 continents around the world, I think 47 nations. And at this point, the majority of our students do the entire courses, 44 hours of video training and education. They do the majority of it online. And like I said, they do it from around the world. We've just been extremely lucky that we started this model. Now, we didn't start out that way. We started out, it was mostly on site. Then we went to VHS tapes, the big bulky VHS tapes. Then we went to DVD. And back in 2011, we started dabbling on the internet with the internet training. And then in January of 2012, we went for it 100%. And I would say probably 80% of our students, well, all our students do the online component. And then out of that, maybe 20 to 25% attend on-site workshops. So the vast majority are online training.
So I know when we first started working together, you were starting that transition going from the DVD to online, and you were still doing some online courses or in-person courses at that time.
Hmm.
Yeah, that was like 9, 10 years ago, right?
Hmm.
Uh, how have you seen people adapt to the online courses over that time? There's a lot of concerned people out there saying, "Oh, it's not the same as it is in person." But I mean, you've been tackling this nut, if you will, for close to a decade now.
Yeah.
Um,
Ooh, the question, the answer for that is very interesting. I've taught at universities, in PT schools, as well as in medical schools. And online education is still an evolving process. And I have to be honest with you, online education doesn't give that same in-person little bit extra that you get from a instructor and a student, where you can actually see the body language and say the little subtle things that make a difference. So there is that's missing in the process. But I think what happens is, if you're a very experienced instructor and you really drill down to the content that you're providing online, and then you also provide some online live interaction in addition to your static courses, the courses that are already set up, students go through. You also offer some dynamic or actual live interaction. It does make a difference, and that live interaction can be online, so it does make a difference. But I will have to say this, and this is from teaching for some 25 years now. There's a little bit lost in the process. And I think the piece that's lost in the process is a little bit of the ability to bring out better critical thinking in students. Now, it doesn't say the students don't get the same education, doesn't say the students don't get the same learning level, but it says that little bit extra of critical thinking sometimes is lost in that internet interaction, unless you're very careful as an instructor. Yeah.
sure, because it's the one-on-one, being able to using all five senses, right,
Yeah.
is a way people learn, and you're kind of moving some of those senses away with online stuff.
Yeah.
But again, I mean, you've been doing this for quite some time now, and
Mhm.
successfully doing this for quite some time. Uh, you know, I feel proud and fortunate to be part of your journey to getting there. Uh,
Mhm.
and you've utilized several different programs over the years. You've
Mhm.
even built your own application for this. What are some of the programs that you found that are A, affordable for the average business owner, and B, that have actually been the best bang for your buck?
Mhm. Hmm. Affordable. Now that one that becomes interesting because that's relative. We currently use a service now called Kajabi. It allows us to upload our videos and our video courses and design membership sites, as well as the content for the membership site, as well as now allowing us to build landing pages, marketing funnels, as well as websites. We started with them back in 2012. And I have to be honest, I went to a workshop in San Jose and attended a course there. And the speaker talked about this Kajabi stuff. We were just dabbling in the whole internet learning process. And we decided to take a chance on this platform. And I have to be honest, the owners of this platform have done a fantastic job in evolving it and giving you more so that you really have a one-stop solution. Now, there is no such thing as a one-stop solution in on the internet or with regard to internet marketing, but Kajabi has done a great job for us. That, along with for a period of time, we used Constant Contact, email marketing program that worked well. Now we're using MailChimp only because it allows us to really interface with our Kajabi service real well. And then just good old fashioned email. We've got a great graphic designer that helps out with some of the things that we need. And I have to be honest with you, a lot of late nights, a lot of frustration because you can't get it to work. And then finally it does work. You don't know what you did, but it worked. So a lot of that, a lot of learning curve. Yeah.
I remember telephone calls at like 9 o'clock, 10 o'clock at night, going, "Why isn't this working?" And
Yeah.
trying to figure it out between the two of us.
Yeah. Yeah.
Um, so yeah, I do remember. I remember those things, and
Mhm.
it's good to hear. I think one of the things that people really need to recognize is that each situation is unique and different.
Mhm.
Um, while not every business needs some of the things that you have with like a learning management system, that type of
Mhm.
stuff, programs like Kajabi do have things to utilize for several businesses
Mhm.
out there. And there are certain things as well. If people are thinking to themselves, "Oh my gosh, I don't want to build a new platform using Kajabi, this and the other," there
Mhm.
are things that they can use within their current sites of Joomla, Drupal, WordPress, that type of stuff.
Sure.
Um,
And we do, and forgive me, we do have a WordPress site, and the WordPress site is our primary site. Now, over time, we do plan on migrating to Kajabi, not because WordPress isn't as good, but because Kajabi, we just decided to make that investment. But WordPress sites work just as well, if not better, and they can do all the things that Kajabi does. Yeah.
yeah. So, I mean, those are really good things to hear and talk about. I know that as well that you've done conference calls in the past with voice conference, and you've done video conference.
Mhm.
How are you utilizing those things still to this day, and how are they making an impact in the way that you're doing business?
Ooh, impact, impact is kind of hard because we've been doing the online training via video conferencing since 2000 and maybe 8, I guess. So it's not really having a impact other than just allowing us to continue to communicate. But for instance, I did a course on Tuesday night. We've had that same Tuesday night course since 2008. And we started out then with, man, I can't remember the format we used back then. We started out with a conference call format, and then we went to a video format. We started with Google Hangouts many years ago. I can't remember when we started with that. So this has been kind of a mainstay of our platform for years. So the impact, I guess, would probably be we're continuing to communicate with people. Ironically, April and May have been some of the best months we've had in a couple of years because people have kind of waded through all the internet paid marketing and found some of our content out there that's direct and to the point. And but we had a young lady, one young lady registered yesterday from the United Arab Emirates. We had another young lady registered today from Stafford, Virginia, right outside of Washington. And about 10 minutes ago, we had another registration come in from Washington State. So this internet thing is just going to get bigger and bigger. And I would urge anyone out there who's thinking about putting their information or their expertise online, figure it out, organize it, put it out there, because this will continue to grow over the next 20 years. I guarantee you.
Yeah, and I think one of the things that I know that you do is that you offer advanced studies, I'm sorry, advanced education, right?
Mhm.
That many people like you have advanced degrees already, but this is a study past that and beyond
Mhm.
that.
Mhm.
Um, and so I guess another thing that's great to know about, and maybe you can talk about a little bit, just not only in your field but in generalities as well, is right now a lot of people are still sheltering in place. I mean, even
Sure.
in Texas, where they're opening up things within the state, and some other states are doing that, it's a
Mhm.
slow rollout. It's not like everybody's like, "Hey, guess what? You can come back and live life normally like you used to."
Sure.
Now's a great time to really further your education, your
Mhm.
studies, to improve yourself, and people can do that with programs like yours. Uh,
Mhm.
and they can do it with yours very simply because it's online.
Mhm.
Uh, and it while there's a pace to it, they can also somewhat do it at their own pace. Although I know yours is a little more complicated than that.
Yeah.
Uh, you've got weekly check-ins and all this other
Mhm.
stuff. But these things are great programs. And what would you suggest to somebody who's looking at programs that do like that? And even if somebody wanted to get into your field of medical exercise training, what should they really do to prepare themselves to take the courses? And what should they do to look at to make sure it's legitimate?
I think with anything out there right now, if you're at home and you don't have, things have changed, you really have to kind of step back and look at your life and say, okay, what is it that I really want to do? It is unfortunate that we've had uh, COVID that has done what it's done to our society. But I think along with that, it's given us a chance to hit reset to some degree, kind of pause and let all the noise stop. And it allows us to kind of reassess our lives to some degree. So I would urge anyone out there that's looking at this time off saying, hey, I really want to do something else, really explore that. And now you get a chance to really explore the internet deeper rather than those first 3 ads that are always the paid or solicited ads on the search. Get down and look at those 3rd, 4th, and 5th items. And you may find those are smaller companies like ours. They just do it in greater detail. And they just don't have the marketing dollars to go up against the big boys. So look at this, what you want to do, research it in great extent. And you know what? It's kind of hard sometimes to really find out, is this legitimate or is it not legitimate? That's the hard part. And folks, I'll tell you, the best thing to do is pick up the phone and call. And if someone's trying to pitch you, hey, but if someone's just telling you, here's what we offer, here's what we do, here's how we do it, and if you're looking for this, join us, I think that's the best thing. Too many times we run into pitches out there. And the greats at what they do don't need to pitch you. They just give you the facts. Here's what you need to know. If you're looking for this, this is what we offer. And I know for us, we don't do much pitching. We'll tell students, if you're looking to do this, this, and this, and you want to get a detailed, comprehensive program, great. But if you're looking to just get the certificate to go out there and move and get moving, we're not the place for you. So I think you really have to pick up the phone and call. I think that's one thing that we've lost that hopefully we'll start to get back is the ability to pick up the phone and call. I get a lot of email inquiries, but I find the students that are really the ones that are really interested will call, and those conversations can be pretty long, especially now because you don't have anything to do but talk to potential customers. So I think the idea now of find what you're looking for, dig deep, pick up the phone and call, and that will assail a lot of your fears with regard to, is this legitimate or not? But you got to do a little bit of research. A lot of research. For
sure. And telephone calls make a big difference. I mean, at this moment in time, it's almost the next best option to meeting in person, because you really can't meet in person.
Yeah.
Everybody has the access to do live streams like we're doing right now. It's becoming more and more popular, but not everybody. We talked about this yesterday on the phone. That not everybody has the access to the quality high stream internet capabilities. I know companies like Verizon and AT&T and Comcast, et cetera, are all trying to ramp that up. But I mean, these are processes that take them months, if not years, to normally ramp up. That they're trying to do in weeks to get people going. So yeah, the telephone call is always a really good thing. In fact, I would suggest, anytime you're ever going to do business with anybody, pick up the phone, call them first. You want to know who they are. You want to make sure they're an actual person. There are so many people, because of the internet, that make it seem like they're here in the United States, they're in your locality, but really they're halfway across the world, and they're not. And it just makes it way more difficult to do business if somebody's halfway across the world, because you're in a different time zone.
And even for those that are here in the United States or here in North America, sometimes you just may have individuals that are not people of integrity that are out there, and they've got a P.O. box someplace, and they're doing business out of a state here, and they just aren't doing it correctly. Many of our members are looking for personal protective equipment right now. And Jason Hodge, the owner of the facility that we use here in Houston, found a vendor, a local vendor here in Houston. The gentleman was he had an oil company, and because of the changes that are going on right now, he converted it from an oil company to a company that now makes PPE as well as hand sanitizing. I'm sorry, PPE and hand sanitizing materials. And it was interesting, when you call the number is talking about it's an oil company. So one of our students called and said, "Hey, Mike, is this really legitimate?" I'm like, "Hey, shoot the guy an email, call him directly. He'll give you the phone number, and you can actually talk to him." And I think once you talk to him, you're like, "Hey, we're just making a conversion, trying to help people, and here you go." So picking up the phone makes a huge difference right now. A lot of people are in flux. A lot of things are changing right now. And again, still the best thing to do. The best part of human interaction is to pick up the phone and talk to somebody if you can't be in person with them.
Yeah, you bring up some really good points. I have another client that is a distillery, and they've actually adopted and adapted to this. They've adopted hand sanitizer, following CDC guidelines and the FDA and that type of stuff. So it's not consumable. We have to remind people all the time that, hey, yes, they're a distillery, but this is, and it's made from alcohol, yes, but it follows the guidelines and it is not consumable. Don't drink it. So that's just a warning out there for everybody. If you're finding a place making it, especially the distilleries, the breweries, etc. Yes, they're changing to help people out because there is a limited amount of hand sanitizer that's out there right now. It is not a consumable product.
No. Yeah, we got, and there's some people out there that just kind of, don't get it. So yeah, we have to kind of continually tell them that. So
yeah, and I think some people, whether you want to buy this or not, the president said that he was making a sarcastic comment, and we don't see the full context of what his comment is. But yeah, I mean, don't drink the stuff. That's not what. If you wouldn't normally put it in your body, don't do it now. Just disclosure on that for everybody at this point. Yeah. But Mike, we talked yesterday, and one of the interesting things, and I've heard you mention it a couple of times, is you're working with people. You're continuously working with people, and you guys are really considered an essential business. You provide an essential service. You not only do the training of people to help with the medical exercise training, but you actually help some clients with actual medical exercise training. How has that been, being an essential business during all this, and what type of precautions and stuff have you had to take and adjustments you had to make in your in-person business?
Well, it's been kind of interesting because you're getting conflicting reports from the mayor, from the governor, and then you're getting conflicting reports from CDC and FDA. And when I say conflicting, they're not majorly conflicting, but there are some overlaps, and the overlaps may be slightly different. I think the biggest thing is for us, and we don't provide any therapy services, but our clients in many instances are referred by their physicians for an exercise program. And in many instances, these exercise programs make the difference between being functional and non-functional. And they have referrals, written referrals from their physicians. So that allows us to actually be considered an essential business only for those clients that have referrals. So from that standpoint, putting together the distancing, social distancing aspects in the facility, along with, we had a huge increase in what we call virtual training. We've done that for a while prior to COVID, but that's become even bigger. But that also leads us to a very critical issue moving forward, not only for us, but for the medical community in general. Virtual medicine or telemedicine, or for us, virtual training is here to stay. It's not going away. Anytime we have a new technology that is introduced into a system, you're going to have the great euphoria initially. This is something you're going to realize, oh, there's some drawbacks here. And right now we're seeing euphoria with the idea of telemedicine. We're seeing euphoria with regard to our community utilizing virtual training. But there will be some things along the way that we have to figure out here, just because issues will pop up. Technology is always leading the way, and policy comes behind. So that's going to be one of our issues down the road. But from the standpoint of providing services, our clients have been very cooperative with utilizing the hand sanitizers and washing their hands, utilizing masks. Our staff members have done very well. Jason Hodge, the owner of the facility, has been excellent in mapping all of this stuff out. And I've tried to be there to be as much of a consultant as I can from working in hospital and clinical settings, because there is a difference between what we consider to be hospital clean and those facilities that are not hospital based. There is a significant difference in that. And I think one of the things moving forward for Americans, and let me backtrack, around the world, will not be just simply, is your place clean, but does it stand up to that hospital standard of cleanliness, which is a little bit different story. So from our standpoint, getting people in has been actually reasonably good. Our clients have been very, very patient. They now are coming into the facility, and the distancing has worked well. Our staff has done a fantastic job. Our receptionist, young lady by the name of Lisa Milner, is coordinating all of this from her home. So if we have virtual appointments, she's coordinating that with the clients. Our staff members, that if they need to come in, are coming in, and they're doing it in a manner that doesn't jeopardize any of our clients that are coming in. And some of our clients coming in are elderly clients, and some of our clients have complicated medical conditions. And we're doing everything possible to make sure if they do come in, they're coming in at times when the facility is at minimal, if not zero usage. And along with that, our staff has been very, very diligent in cleaning and maintaining a very sanitary environment. So it's been a little bit of work, but you know what? I have to be honest with you. I think for our industry, the fitness and wellness, as well as the health industry, that level of cleanliness or what I call hygiene is going to be very important across the board. And we should be the ones leading that, because we're going to have to see that in restaurants. We're going to have to see that in the airline and travel industry. So this is going to make a huge difference across the board. Our new norm will be one of a higher level of hygiene, I think.
Yeah, and it's very interesting because you deal with a lot of people who are considered high risk right now,
Yeah.
right? Yeah. And then you bring up the interesting point of the fitness industry. Now you're connected to the fitness industry, but you're not necessarily what people think of.
Yeah, I would say we're on the fringes. Yeah.
Yeah, right. You're not like the gym that people pay, whatever they pay a month to go to the gym and that type of stuff. And when you think of gym, a lot of times you think, okay, this is a place where people go work out, but you see that guy who has never been to the gym before, or even the guy who shows up to the gym every day, that they don't clean the equipment and that type of stuff, which I personally find to be unkosher and uncouth, and you really should be. I mean, you're going to the gym, take your towel, bring your own water bottle, and then also they provide everything you need to clean it off before you use it, clean it off after you use it, right? I mean, these are some basic things, but how do you see, just kind of knowing some people in that industry and working with that industry a little bit, how do you see them adapting to that as things move forward? Because that's going to be a huge factor for governors and health officials to allow gyms to reopen, because they this sounds a little bad, but I can't think of another way to say it. They really are a cesspool for germs, right?
Yeah, and I've said this, and if you are attending any of our courses, I've said this many times. There are two places you go if you want to get find bacteria, get an infection. You go to the hospital, you're admitted to the hospital, or you go to a health club. Now, that doesn't say anything ill about them. It just simply says, in many instances, we have a number of people that are in a confined space, and they're breathing and they're coughing. You're working out and you're working out hard. Sometimes you may cough. And then in the hospital setting, we have individuals there that obviously have medical issues. So it doesn't say anything bad about them. It just simply says this is our opportunity to really clean those up better. Now, I will say this about the fitness industry. Being a physical therapist, for years we had sports medicine clinics where we had some fitness equipment. We weren't health clubs, even though we did purchase a health club and make it a physical therapy facility. One of the things that always we've seen in the fitness industry is the idea of a higher level of cleanliness, especially in the locker room settings. I know my wife bought a health club membership for me a few months ago because she worked in the area of town where this facility is, and she bought the health club membership. It was like a 2-for-1 deal. And I went over a couple of times, and I was really just amazed at the level of lack of cleanliness in the showering and in the restroom facilities, to the point I just really didn't want to go back. That hopefully will change. And I think hopefully with the fitness industry, they will look to the medical community and to those individuals that are managing housekeeping and maintenance staffs in these hospitals. And they've had the job of cleaning operating rooms, patient rooms when patients are discharged. They've had the job of cleaning ERs for decades. I hope they reach out to those individuals and say, hey, how can we do this in this setting better, rather than just simply looking within the industry and saying, okay, we'll adapt the CDC guidelines and use them here. There has to be a certain level of professional experience and critical thinking that's brought in by these individuals that have that experience coming over from the hospital little setting to say, okay, here's how this is done. There is a significant difference. So hopefully we'll see that along the way too. It allows us, so this gives us the opportunity to evolve and do bigger and better things. And anytime you can improve health and the standard of health across the board, it's a good thing for anyone. Yeah.
So you're talking about bridging the gap between medical and fitness?
Yeah. And you know what? For that matter, bridging the gap between what would you say, cleanliness and hygiene, because the airlines are going to have to do this. We're going to have to do this in local transportation, subways, buses, things of that nature. We're going to have to do the same thing in school systems, especially when we're dealing with the younger kids. We're going to have to really be diligent about this. And, my thing is, hey, we can do it. I can tell you, as a young Army officer, when I joined the Army back in 1982, I'm like, hey, you know what? I didn't know anything about mopping the floor. I guarantee you, within that first 30 days, I learned to mop a floor and clean a bathroom to the point it was shiny and clean. And that idea you could eat off the floor. I remember my drill sergeant telling me that. You can be able to eat off this floor, Jones. And he was right. It's something we can do. We just have to gear up to do it with the proper guidelines and the proper equipment. Yeah, but we've seen things like this before. As a world and as the people of the United States, we can do that. We can do this. It's not a problem. It'll take some time, but we'll get through. Okay.
For sure. Mike, I want to be conscious of your time. I know you've got a bunch of things going on. You're really busy. I promised you about 40 minutes or so. We've been on talking for about 30 minutes or so.
Oh, okay.
I want to make sure you still have some time to talk with us a little more. And also, is there anything that we haven't talked about that you really feel it's important to get out to people about the situation, about how they can really focusing on it? I mean, we know each other. We know each other really well. We're not only we worked together for almost a decade. We've been friends for almost that whole time too. We check in each other periodically. I know your background. Your background comes from physical therapy, really taking care of yourself and that type of stuff. And people are locked up in their homes right now, right?
Mm-hmm.
And they feel like their freedoms are taken away from them because they're not necessarily listening. They don't understand there's a big difference between shelter in place and quarantine, right? Quarantine is legally telling you cannot go out because you have an infectious disease. And if you go out, you will infect people, right?
Mm-hmm.
Shelter in place is, hey, stay at home as much as you can. But with that, you can still go out and do things to exercise and that type of stuff. I know we were talking yesterday, and I think you were probably on a stationary bike, but you were on a bike doing stuff. What are some of the things that you would suggest with your background, your education, for people, for people to do right now, just to get out there and get the blood flowing and the fresh air that they can still do in socially distancing? I mean, some people don't like riding bikes. Some people don't like going jogging, but there are other things they can do. What would you suggest that they do?
Well, I mean, first thing is get out there and start walking. Just get out and start walking. Or, you know what, if you don't want to walk, just get outside. If you got a balcony, sit out on the balcony. If you can sit outside and you can social distance and sit outside, just get outside. I think also the other thing that's going to happen here is, and it's happened with us, when you finally come down off of that high every day of hopping in the car and driving through traffic and then dealing with your coworkers and then coming home, after that's gone for a few days, you're like, wow, I feel completely different. And I think what we may find is people will now suddenly start to get motivated to go out and do more things and get more active. Again, this is a great time to kind of reinvent yourself. So anything that you see that you want to do, try it. My wife and I, we bought bicycles about a year or so ago, and they sat in the garage for eons. And when this hit, first thing she did was, hey, let's go bike riding. We have a puppy, Reese, who's a golden doodle, and he's completely nuts. And we've gotten used to taking him out on long walks in the mornings. That's given us a chance to spend a little bit of time together and get to know each other even more so. We took our garage and kind of converted it into a gym. We have one car that we still park in the garage. I park my truck outside of the garage. And I was able to take a television, hook up YouTube TV to it, as well as Netflix and Amazon TV. So I can go out there and ride the bike. And if I'm studying something, via Chromecast it up onto the television and still work and do everything. So it's just a matter of whatever you want to do. And the great thing about this is if you have access to the technology, and it doesn't have to be great technology, it doesn't have to be high-end technology. There are a lot of things that you can do to make this whole process easier. And you got to get out there and you got to start doing something to get yourself moving. There are tons of things that you can find on YouTube or other channels out there that will allow you to exercise. I know a number of our medical exercise specialists have broadcast free workouts. They've done on Facebook or they've done via YouTube. Get out there and find those things. You will find something that reaches your level, whether it's a low level or a high level. The issue is not the level. The issue is just getting up and getting something done. Get moving. And once you do it, you'll feel a lot better, I guarantee you. And it'll motivate you to do a lot of other things too.
Sure, and that helps not only out with your physical health, it helps out with your mental health, and all these other things. I mean, we hear all these stories about how we have to reopen everything again right away because of mental health. But really, I think what heed your advice of just start doing things. I mean, you can make it happen inside your house. How many? There are people who are out there who don't have gym memberships, but they're in great physical condition because they've adapted to what they can do in their homes and in their workplace. I mean, you were in the Army, you were Army Ranger, adapt and overcome, man. I mean, that's the motto of the United States Armed Services: adapt and overcome. And you know what? Sometimes you're told to adapt and overcome. And there's situations where you're kind of being told, "Hey, adapt and overcome." And this is nothing like the military. You know, I did military affairs for 5 years. But you know, you can take some of those things and really incorporate them into your life and really become integrated with what you want to do in your surroundings and your settings. Just like Mike was saying, you know, it's easy to make some stuff in your garage. I mean, we live in a day and age where you can buy an Amazon Fire Stick for $20. As long as you have the services that go along with it, and some of them are even free. You can plug it in. And right away, you're starting to get stuff. I mean, watching YouTube itself is free.
There's so many things I've watched on YouTube. I'm like, wow, I didn't know that you could do that. And I've learned and watched it. We've learned to make cauliflower pizza.
Yeah,
my wife had started on the keto diet, so we did cauliflower pizza. I did it, and she didn't get sick, so it worked well. But yeah, I think hopefully all of this makes us take stock in our own selves a little bit. I was telling my a friend the other day, he was asking me, man, how are you able to stay home and you're okay and you got to wear the mask and everything? I'm like, man, I remember going through parts of training, and this was after Ranger School, where I remember we had a reforger exercise one year where we had to walk around in gas masks and nuclear biological equipment for like a week. I mean, and we were in Germany at the time, and I'm like, it was hot in Germany, you know. Europe does get hot, especially in the summertime. So I think it's just a matter of mind over matter. And I know that's easier said than done, but hopefully all of this ratcheting everything down allows us to spend a little bit more time with ourselves. It allows us to spend a little bit more time with our friends and families and really start to realize what really is important and what's not. We were going way too fast there, I think. And somewhere along the way, the world said, we just need to hit reset. And reset's not a bad thing if you just use it and you step forward. And the biggest thing is, let's just move forward as a nation, as a world. We've been through worse. I remember talking to my father about his life during the Depression years. And, you know, a couple of times I've thought about that. I'm like, man, if Daddy could live through that, I can live through this. And I think sometimes we need to draw on those stories from older members of the family, what it was like in those days. I remember when he told me about when the Japanese attacked Pearl Harbor, and the next day he joined the Army and what it was like, or other things that we've gone through. We can get through this. We just have to muster up the strength and the courage, and it's there. We have it, and we just got to say, okay, you know what? It is what it is. We're going to get through this, and we'll be okay. I sincerely believe we will be okay, and whatever is after this, we'll be able to deal with that too. As long as we keep believing we're in this thing together. All of us are in it together.
I couldn't agree with you anymore, Mike. It's funny you mentioned cauliflower pizza. We've done just on a side note, we've done almond flour pizza because it's also
Mhm.
it's
Mhm.
and the kids like it a lot. We've actually made almond flour sourdough bread.
Yeah.
Uh, it takes a little longer to cure than
Yeah.
a normal sourdough bread, but it comes out pretty well. Actually, the almond flour is actually pretty easy to get. It's not as expensive as some of the other things. And the kids, and I'm not a big cauliflower fan either. It's just it's got that cauliflower graininess to it, but almond flour, it's almost like a perfect substitute. It's
Yep.
actually very, very good for you.
Yeah.
Uh, it doesn't really add much of an extra flavor to it. And at one point the kids didn't even know that we were making pizza with almond flour in the crust. They thought it
Yeah.
was great. We were making it home. So it's really easy to do, easy to overcome. You can still eat healthy. Actually, it's easier to eat healthier now
Yeah.
having to live at home, right? Because you know exactly what's going into your food. I hear all these people talking about, oh, I've put on the quarantine 15, and I'm like, I've lost like 8 pounds during this whole thing because we're eating at home.
Yeah. Yeah.
It's easier to portion. It's easier to portion better because
Yeah.
you're not going to a restaurant and getting all this food that you paid $20 for, and like I better eat all this because I just paid $20 for that meal.
Yeah.
You know exactly what's going into your food. You know it's being made with, and so maybe we'll do this again. We'll do a cooking thing.
Now, you might want to check your liability insurance on that one, Mike, because if you let me cook, somebody's gonna get sick someplace without my wife there to kind of keep me from overdoing it. But I'll be certainly glad to come back. One last thing I'll say is this: we've lived here in this home for about 3 years now, and it's an older neighborhood, and we have a lot of older neighbors around us, and we've got to know a couple of them. But this one thing with this COVID, I've gotten to know all the people in the community, even people that are 4 or 5 blocks over, because you see everybody out walking, and you're able to interact with them. And you know what? I have to be honest with you. I want everything to open back up. I want us to, eradicate COVID, or as best we can eradicate it. But I have to be honest with you. I'm kind of enjoying getting to know my neighbors. I'm kind of enjoying walking the dog every day. I'm enjoying that, when I go out, there's not as much traffic. And I'm also enjoying getting a chance when I do go out, even though you have on the mask and gloves, we do get a chance to talk a little bit more. Our human interaction has gotten better. And I know some people are inside, but even with that, you may find this is going to improve our humanity, I think, a little bit. So we'll see. That's just my take.
Back to a simpler way of life 25, 30 years ago, pre-internet. And while the internet now is helping us do things like this right now, right? It's also making us realize that, hey, there are people that live next door that I've lived here for 10 years and I've never met them. And I don't know why. That it's one of those things like, you know what? I used to love going riding my bike, but I haven't done it in years. I should get out there and do that again. It's so funny. I actually tell Crystal this all the time that it's hard for me going to the grocery store right now because I'm so used to going to the grocery store and I'll just have random conversations with people while waiting in line. You know me, I'm a very shy person. So that's hard for me to open up and do that. But in seriousness, I just have random conversations. And right now it's really hard to do that. You just can't talk to people because they're 6 feet apart. You've got basically two shopping carts between you and the person in front of you. And I really miss that. But I really enjoy, like I go outside and I'll do work on the yard or something. And we have some friends who got us access to pallets. So we're building a deck out of pallets in our backyard. I mean, we're going to build this deck that would have cost us thousands of dollars. We're spending a couple $100. And our neighbors on kind of both sides hear us doing work and they're like, hey, what you doing over there? We have these conversations with them, and we're talking about that type of stuff. And it really is a nice thing. It brings me back to when I was a kid, in the 80s, and people, you could go outside and play and you knew your neighbors, and the neighbors would come over for dinner like once a week or once a month. And, everybody would go out in the front yard or in the backyard and they would talk with each other. And it's just these nice things that we don't see anymore. And it really is a way of things slowing down a little bit from where we were. Everybody was always on their phone, right? Left and right on the phone. my 6, 8, and 10-year-old were always asking me, "Can we get a cell phone? We need
Mhm.
a phone for this." And they don't really ask that much about that type of stuff anymore.
Yeah.
Now it's like, "Hey, Dad, can we go out and play on the trampoline?" Yeah, that's what we bought it for. Can
Yeah.
we go out and play basketball? Absolutely. Can we
Yeah.
go for a bike ride? Yeah. Give Mom and Dad 20 minutes. Let us finish up what we're doing. We'll go for a bike ride. I mean, we've been riding our bikes at least once a week since this whole thing started. We live in the southwest corner of Sacramento, in
Mhm.
the Thomas area,
Mhm.
and my kids go to school in West Sac. It's
Mhm.
about 10 miles from our house or so.
Mhm.
And we've actually made it about 3/4 of the way to our kids' school from our house, riding our bikes and back with the
Yeah.
kids, and it's taken us like 3 hours. Now, mind you, we stop and have lunch, and
Yeah.
we're stopping, and probably every half an hour, the kids want to stop and have some water, and that's fine. They're staying hydrated. They'll go through 2 to 3 bottles of water on the trip. I can't complain.
Mhm.
They're 17 ounces, so they're drinking their almost all 8 cups of water they need to drink on one bike ride. Hey,
Mhm.
more power to it. I'm very happy with that. Uh,
When I got one, my wife is an avid bike rider.
okay.
So as I said, we bought these bikes several months ago. We haven't used them until recently. She just came back from a bike ride and she did a 25-mile bike ride and
Well,
out and back. And I'm like, hey, you know what? You go, girl. I'll take care of the bike. I'll make sure it's got oil on it and the tires are good, but I'm not doing that bike ride. So she does that every afternoon and she loves it. And you know what? While she's out doing that, I usually go in the garage and work out on the bicycle. And then I do some, we've got rubber tubing that we've set up with various poundages. So it works. It works. And I agree. It has been a great chance to get to reinvent ourselves, get to know one another again, and meet neighbors that are down the street. And I've done the same thing going to the grocery store. But even with the mask on, I force myself to speak to people. And it's been interesting when I've done that. People are like, "Hey, how you doing?" And they'll talk, and we can still see each other's eyes. And the conversation is in the eyes; it's not in the mouth. So we'll get there. It'll take some time.
I
We'll get
agree. I
there.
agree, Mike. Again, I want to be conscious every time. I know you and I can talk for hours. We've had many conversations about business, about life, about just in general that have lasted hours and hours. But I want to make sure that I'm conscious of your time. And I know you told me earlier you have a bunch of things going on today. So, really, thank you for taking the time to
My
come out
pleasure.
and talk about this. Some of the great insight that you've given for 20 plus years of actually dealing with stuff on the internet and doing trainings and
Mhm.
all this other stuff. Um, I hope that people really take a listen to that. I've been with you through some of those struggles.
Mhm.
We still probably talk once every couple of months about
Mhm.
business.
Mhm.
Usually when we talk nowadays, it's more about personal stuff and catching up. But it's usually probably once a month, at least once a quarter, where we still talk and we still do work together. And I can't say enough about how great of a business model you have, how wonderful of a person you are, and just a plethora of knowledge that you are. So I really appreciate that. I really appreciate
Sure.
not only
It
being
was my pleasure. It's been my
the long-term loyalty as a client, but also as a friend. You know how much I appreciate you. Um, in fact, oftentimes I'll just send you a quick text for those who want some insight and to say, "Hey, Mike, I really, really appreciate everything that you've done for me. You've been there for me when I've had kids that were born, all this other stuff." And man, I really, really, really appreciate it. Really appreciate you taking the time out today.
Sure. It's
Uh,
my pleasure, man. It's my
I,
pleasure. You know what? Like I said, we're all in this together. And part of it is you just have people and we treat each other well from way back when. It all works. It all works. It's just, and I'll say this because my daddy used to tell me this. He said, it doesn't take great courage, but some courage just to treat people fair. I remember we would go to restaurants as a kid, and whoever would be our waiter, my father would always ask them their name. And I do that now. My father's passed away years ago, and my wife asked me that. And I remember Daddy always used to say, it doesn't take very much courage to just simply take the time with people. And you and I have done that for years. So Anyway, I've got a wife who is banging at the door and a puppy that wants to go out for a walk. So I do need to run now, but it's been a pleasure. To all of your viewers and listeners, all the best to you guys. Hang in there. This is going to eventually pan out and we're all going to do better for it. But please remember, we're all in this thing together. All right.
Absolutely. Thank you so much, Mike. We'll talk really soon. Great seeing your face. Say it's my best to your wife, and we will talk soon, man.
Okay, man. Take care. All the best. Bye-bye.
Bye-bye.